Hi, so today we're going to be scanning venous legs. We're going to be looking for DVTs, and we're also going to be looking for Baker cysts. So when we have the patient change, we want to make sure they take their pants off. If they have compression stockings, they want to take those off as well. And we want to make sure that they can leave their underwear on, but we want to make sure we can get all the way up into that groin. We're going to tuck a towel in, and then we're going to have the patient lay supine with their leg bent slightly and then angled out. So that way we have the medial aspect of the leg. So we want to make sure, so if you want to go this way, we're going to make sure that on our machine we select the right probe. So it's typically the 9 linear probe. And you want to make sure it's under the correct setting. So for this one's vascular, LEV stands for lower extremity vein. Depending on your machine, your settings are going to be a little bit different. So we're going to take our probe and we're going to start right in the patient's groin. And then what we're going to see is our vessels. So let me just get some of my settings good. Okay, so the first thing I want to scan is the common femoral vein. So now I'm scanning a little bit inferiorly, and we can see that the greater saphenous vein is coming off. You can get right up on that screen. Yep. So we can see that here, I'm going to do this, that the greater saphenous vein is coming off or dumping into that common femoral vein. So I want to go up a little bit more proximal. So proximally, I'm only going to see the common femoral artery and the common femoral vein. I'm going to do a split screen of that and compress. We want to make sure that the walls completely touch and that there's no gap left in between, proving that we have no blood clot. So right common femoral with compression. My next picture is going to be greater saphenous and common femoral. So I'm going to come down a little bit inferiorly, and we can see our artery, vein, common femoral vein, and greater saphenous vein. I'm going to split screen that, and I'm going to compress all the way, making sure that there's no blood clot there. My next picture, I'm going to come down a little bit more. So now I'm following this common femoral, and I'm going to see it split off. I'm going to see this vein coming off right here. So if I go up proximal and I come down a little bit inferior, I can see this vein coming off. So this diving deep is going to be my profunda vein. So your protocol is going to be different everywhere you go, but I'm going to take a compression picture of that profunda and make sure that that completely compresses. I'm going to come down a little bit more. So once we move past the femoral vein, once we move past the profunda vein, the vessel is still the same, right? So technically from common femoral, greater sap branches off, profunda branches off, and we're still looking at the same vessel. So it's technically, what I like to say, is the same road, but we cross state lines, so it's called something different. So it has a different name to it. So now this is going to be our femoral vein. And that I'm going to split screen. I'm going to take a compression picture of that, making sure our wall is completely compressed. This is going to be prox femoral vein with compression. I'm going to come down even more, compressing every 2 centimeters as I move down the leg. So we can see our vessel here. It gets actually really tiny at this point, and I'm going every 2 centimeters. So that's about mid distance to the patient's thigh. So I'm going to, and we can see this compressing right here, right? And that's going to be our mid picture. And then the next one is going to be distal. So I'm going to keep going every 2 centimeters. Every 2 centimeters we compress. And we're going to call this distal. We're going to compress. And now what we're going to do is we can see that this vessel dives. So if I move down a little bit further, it dives deep and I can't really see it anymore. So now what I'm going to do is I'm going to go posterior to the patient's knee. So I'm going to come posterior to the knee right here. And now what I want to do is I want to make sure that I've covered the entire vein. So if I left off on the patient's leg right here, if I compressed all the way down, and then this is the point at which the vessel dives and I can't see it anymore, I still have to cover this whole vein. So I'm still responsible for this piece, even though I can't see it when I come at it anteriorly. So now I'm going to be behind the knee, posterior. My notch is facing up. I'm gonna come behind the patient's knee and I'm gonna find their popliteal vein, and I'm gonna work backwards, making sure that I can compress that vein all the way up until I meet the point at which I left off. So now if we look at our screen, I'm gonna compress, I'm gonna move up proximally, compress, proximal, compress, and I am now where I left off. So I know that I've covered this entire vessel and that it's completely clear of a DVT. So this is going to be prox pop, and now I'm going to come down a little bit more distal, compress, compress, and this is going to be my distal pop. Now I'm going to come down a little bit more. So once I know that this is distal pop, I'm going to see branches coming off of that vein that are going to go up superficially. So they're going to be paired veins and arteries. So we can see that these are going to be the gastroc vessels right here. There they are. So they split again. So it's going to be 2 veins and an artery, 2 veins and an artery. Typically hers are kind of side by side. Typically the medial gastrocs are going to be a little bit more superficial and the lateral gastrocs are going to be a little deeper. So see, we can see 2 veins and an artery, two veins and an artery in the middle, 2 veins and an artery in the middle. So it's a little grainy on these machines, but let's see if we can. And we see that compression. So that's going to be transverse right medial lateral gastrocs with compression. Some places are going to have you do a sagittal compression on these veins. However, I'm just going to show you the transverse compression. So now that we covered that, we're going to go back up to the patient's groin, and we're going to see, we see our greater saphenous coming in, so we know that we have to go higher than that to get our common femoral, right? And we can actually see a valve right there dancing a little bit. So we're going to turn on this. Make sure we have contact, sorry. And we're going to put color on her. We want to make sure we can get that greater saphenous dumping into the common femoral, because that proves that we're in the right spot. Sag, right, common femoral, greater saph. And I'm going to Doppler the greater, the common femoral portion of it. So we want to have one waveform with no augment. Right now we know the patient doesn't have a blood clot because we just assessed the entire vessel using transverse compressions. So now we want to make sure that we're doing a comparison picture. So what does that mean? We want to do a Doppler waveform, spectral Doppler of the common femoral on both the right and the left side. You want to do it without changing your scale. So I'm taking this image of the right. I would then take the same exact image just like this on the left without moving that scale, and we want those pictures one after the other, so that way the radiologists can compare those waveforms. So I would do that on the left side, and now after doing that I would come back and I would do another image with an augment. So you want to make sure that you're doing that picture or that spectral waveform without augment and then with augment. Now I'm gonna turn my probe transverse. It's always easier to find the vessel in transverse, so I can see that's my greater saph coming off. I'm looking for profunda, and we can see that it branches. So I'm gonna turn on my vessel right here. I'm gonna put my color on, and I'm gonna angle my box. So that right there is profunda. Now I'm just going to move a little bit down, not much, because although this is profunda right here, this is my femoral vein. So I don't really have to go far at all to get that color picture. Ooh, I'm sorry. we want prox femoral vein. Then we're gonna do spectral. And when we're augmenting, we always augment inferior to where our probe is, because that's how we're really gonna push that blood up through those veins. Now I'm gonna scroll down on the patient's leg, and I'm going to turn at the mid portion. And get a color picture. I know that there's no pathology, so I don't really have to do much with the mid. Depending on your facility, you may have to Doppler mid no matter what, but here we don't have to if there's no pathology. So again, I'm gonna turn transverse and follow it down until it dives. I'm gonna come up a little bit more proximally to where I can see my vessel. Now I'm gonna turn on it, and that's my distal femoral vein, and I'm gonna do a spectral waveform of that. Augment. Now I'm going to come behind the knee, so posterior we're going to get that pop fossa, or pop vein, sorry. And I'm going to turn on my vessel. This is going to be prox top vein. I'm going to augment that, and then I'm also going to do a distal pop vein. So I'm just going to move a little bit more distally. I'm going to put color on it. Here is where you might want to use your slow flow option if that's a button that you do have on your machines. It really is helpful, especially in the pop fossa area, because you tend to get slow flow down here. So that slow flow kind of adjusts all of your color settings to really get that vessel to fill up. And that's distal pop. Now, the next thing I'm going to do is I'm going to look for a Baker's cyst. So here on the patient's leg, we want to make sure that we're medial to the knee, because that's where the fluid is going to come from. It's going to be synovial fluid from the knee joint itself. So it's going to be coming off of this. I do want to make sure that my probe is medial to the knee. Typically, Baker's cysts hang out somewhere in this area, although sometimes you can get them extending all the way down to the calf. So obviously you would assess for that as well. I did scan this patient before, and I know that she does not have a Baker's cyst. So on our screen, to make sure that we're in the right spot, proving that we don't see a Baker's cyst, I'm going to make sure that I can see the joint in the picture. And we're looking at this area, the soft tissue area right here. And that's going to be my right pop fossa picture. Now I'm going to have the patient bend their knee and move their foot up. Good. So now I'm going to be medial to the tibia. All right. So your PTVs and perineals are going to be medial to the tibia. And now here on our screen, you can see the bone, right? And our vessels are going to be somewhere next to it. So what I'm going to do is just in transverse, I'm going to scan up and down the patient's leg. I can see some constant vessels that are right here. So my eye's kind of drawn to that area. And then I'm going to see if I see any vessels posterior to it as well. So I think I see some right there. Now what I'm going to do is I'm going to turn on these vessels. So I know that they're called posterior tibs, but posterior tibs are actually anterior to the perineals. So these are the perineals right here, and if I scan a little bit medial on this patient, we can see the posterior tibs. So they're kind of the opposite of what they say they're going to be. So I'm going to take, we have one vein right here. We have another vein here. So these are sag. Let's see if I can get that again. So my slow flow is still on. So I can see those are posterior tibs right here. So here's one. And now the reason why I'm having the patient bend their leg is so that way the blood is kind of pooling in their calf. We want to make sure that those vessels are as dilated as possible because it's really, sometimes they're really difficult to get if they're really tiny. Posterior tibs. And now the perineals are going to be deep to that. So these are the perineals coming off right here. So that's one. One's there. There they are. They're paired right here. So you have two veins and an artery. And those are the perineals. Oh my goodness, sorry. Oh, I lost the picture. Well, see if I can get it again. There they are. Pretty. So sag, right, pero. All right, and then actually the PTVs are coming off a little bit easier right here. So that's one of the PTVs right here, and then the other one is right here. So another way to get PTVs, if you angle your leg out one more time, angle it out for me. So we're gonna go by the ankle. So sometimes it's hard because a lot of patients have a lot of edema up here. So if we go by the ankle, we're gonna see those PTVs right here. So that's artery, vein, you see it right there. Vein, artery, and vein. So that's how we look at distal PTVs as well. It's by the ankle, medial ankle.